Good day, ladies and gentlemen. As a culmination of our marketing class, we present to you our marketing plan for ValuCare, a health maintenance organization that you can count on. We are Group 5 from the Ateneo Graduate School of Business V84 Marketing Management under the guidance of V Coach Bong De Ungria. We are value creator Kevin Ang, medical entrepreneur Racheli Tesorio, and health deliverer Heidi Lazaro. For the outline of ValuCare marketing plan presentation, the primary target market are BC individuals who seek financial aid for hospital bills during emergency and medical situation. These patients have problems in securing financial assistance for paying medical bills when they get into an emergency. Their present solutions include utilizing their own out-of-pocket funds, availing PhilHealth benefits, or getting loans from the bank, family, and friends. The unique selling proposition of the brand is its ability to shoulder medical bills during times of emergency and hospitalization. ValuCare's positioning in the market caters to BC patients aged 25 to 35 years old and willing to pay for health insurance. The peso market size is at 1.9 billion pesos annually. ValuCare's product strategy is affordability and having access to a wide network of healthcare specialists at bang-for-buck packages. The price strategy of ValuCare is higher than MaxiCare and Medicard, offering the most optimal value for its customers. Its promotion strategy is manifested in the 8 modes of communication. The place strategy of ValuCare involves strategic placement in healthcare facilities nationwide. We will also discuss about the key adjustments of the 4 Ps made by the company to alleviate the COVID-19 situation. Lastly, we'll share with you the Panalo winning strategy by ValuCare, which is highlighting the frontliners as unsung heroes of the pandemic. So what is the profile of the target market? In terms of demographics, these are people who are aged 25 to 35 years old, B2C market, working in a corporate setting, single or married with children. In terms of psychographics, they prepare for emergency funds for the family, values health and safety during crisis, financially literate, pays for bills, and disciplined with money. Their behavior involves being health conscious, liking to make financial investments in stock, life, health, forward-thinking individuals who save for a rainy day to be secured in any medical situation. These patients have problems in securing financial assistance for medical assistance for paying medical bills when they get into an emergency. There's a need to find support for paying very expensive emergency and medical procedures. Getting into emergency situations is expensive and unpredictable. It can happen anytime, anywhere. The salary of the employee cannot be enough to pay for expensive medical bills. Given these problems, the current solutions include using their own out-of-pocket funds or availing PhilHealth benefits in paying for their medical bills, getting loans from the bank, family, or friends, converting or selling their assets like real estate into liquid. The life savings of a patient can be quickly drained when one person gets sick. Enter ValuCare, a health maintenance organization that is there to provide financial aid for the hardworking Filipino employee. With its strong network of doctors, hospitals, and clinics nationwide, it is a company that you can count on. Having a membership card under the company has its perks and privileges. It covers many medical diseases, emergency illnesses, and surgical procedures when it happens to you in the future. It has a unique selling proposition for availment convenience. You will be served well by the customer care department of the company. First day touchpoint in the sense that when you get admitted in the hospital, the ValuCare agent calls your phone number to ask how you are doing. With its wide array of health providers nationwide, ValuCare is always there for you. It is partnered with its sister company, New World Diagnostics, a homegrown diagnostic laboratory that is run by doctors, providing convenient home service testing at the safety of your homes. ValuCare carries with herself an in-house 24/7 call center department which can answer your calls anytime. It offers a basic teleconsult platform for its members seeking expert opinion from a doctor online. So, who are the companies under the service of ValuCare? There's a good number of large corporate businesses under their helm. Industries in SM Group, banking and finance, food and beverages, government, hotels, insurance, manufacturing, publishing, merchandising, restaurant, and the Luciatan group of companies are all covered by ValuCare. Large volume companies like PNB, BDO, SM, and Ace Hardware are ValuCare customers. In line with this, the positioning of the HMO is seen. In the competitive positioning map, ValuCare positions itself as having low-priced insurance products for large business corporations. MaxiCare, on the other hand, focuses more on the small and medium enterprise companies at much lower price ranges. Medicard focuses more on the individual employee, having customizable packages for every individual of any age. With the benefit matrix set for the three brands, there are various categories: coverage for outpatient, inpatient, emergency, having standalone clinics, having customizable packages, having health and awareness, wellness campaigns, providing coverage for balikbayan senior, having dental coverage, and financial assistance in international settings. For ValuCare, it offers superb comprehensive dental coverage and global emergency coverage for her members, as these are optional for MaxiCare and Medicard. Generally, the price of ValuCare insurance packages are higher than those of MaxiCare and Medicard. This is due to a wider set of disease conditions coverage and better room rates, adhering to the younger aged population. Medicard and MaxiCare insurance packages are more fit for the older subset of consumers. According to the Insurance Commission data on market size of HMO, ValuCare has captured an average market share of 5% during the past 5 years. It places fifth in the HMO industry, with MaxiCare as number 1 and Medicard as number 3. ValuCare has captured 1.9 billion peso market size out of a total peso market size of the HMO industry at 51.5 billion pesos. Against all odds, ValuCare remains optimistic and resilient in its climb towards the pinnacle, further increasing its market share. For the product strategy, ValuCare offers 3 accounts for 3 different primary target markets: the individual account, the family account, and the corporate account. For product composition, the product of the company is generally affordable, offering wide access to healthcare, accredited in major hospitals and clinics nationwide, offering global emergency access, a comprehensive dental coverage, and offering financial assistance to first-degree family members. The core benefit of the 3 HMOs include offering financial aid for payment for medical bills during emergency and hospitalization. The basic product involves having access to a wide network of hospitals, clinics, and doctors. What delineates ValuCare, MaxiCare, and Medicard are the presence of prepaid emergency cards, access to MaxiCare clinics and MaxiCare physicians for MaxiCare. For Medicard, they offer products for senior citizens and balikbayans. On the other hand, ValuCare offers Assist America global emergency coverage and a comprehensive dental coverage. For the price strategy of ValuCare, they price their packages at much higher rates compared to its competitors. It's very important to take note that prices may vary depending on the hospital room, whether it's an executive suite, private, semi-private, or charity bed, maximum benefit limit of diseases covered, age of the customer, disease coverage, extent of access, and presence of health awareness campaigns. Prices increase as these factors change during the negotiation discussions with the customers. Access to the big five hospitals like St. Luke's Medical Center, St. Luke's Medical Center Global, Makati Medical Center, Cardinal Santos, the Medical City, will also increase the prices of premiums paid for. In a nutshell, there are various price ranges of insurance products among the three HMOs. ValuCare prices its products in the 8,000 to 27,000 pesos per year price range. The market leader, MaxiCare, prices it as low as 800 pesos to 13,000 pesos per year. Medicard, on the other hand, prices it as 500 to 30,000 pesos per year. So for individual and family accounts, it's essential to note that the more insurance riders are present, the higher the cost of the insurance products. On the contrary, for corporate accounts, which involves large numbers of employees, the more individuals who avail the health card, the lower the price of the product can be pushed for. In the rules of actuarial science, the law of large numbers prevails in the HMO industry price war. Higher volume leads to higher prices. In line with this, negotiations and relationships play a part. The art of negotiating is essential in clinching insurance sales more than the price. The relationships built in agreement with the skills to communicate, tactics for making the contract, and collaborating with human resources properly is the goal, to build excellent customer care and relationship, leading to retention and renewal of insurance plans of said companies. For the promotion strategy of ValuCare, it has evolved throughout the years from that of hard printing into that immersing towards the digital age of marketing. ValuCare has been promoting itself through the World Wide Web, YouTube, Facebook, LinkedIn, Twitter, Instagram. The HMO industry lives in the quantum realm digital marketplace where they all compete in a friendly yet cutthroat environment. ValuCare carries with herself its own arsenal of elements to thrive and strive in the digital world. Outside this digital matrix, ValuCare never forgets to communicate the messages in the real world by carving events experiences, outreach programs, and advertising through newspapers, wellness seminars, public relations, wellness activities, and personal selling. The company shares its platform to the people. For the play strategy, ValuCare positions itself in HMO concierges located strategically nationwide, leading to faster approval, strong coordination for bills payment. Many big-name hospitals are accredited with the company, including the following. This leads to many benefits for the customer having wide medical coverage and access to their health needs. To adapt is to survive, and the 4 P's of the marketing mix have to adjust to the environment. In terms of price, new insurance products can look into market penetration pricing, enabling the company to increase its market share. For existing insurance products, strategies like product bundle, optional product, and promotional pricing can be done. In terms of product, looking into the product lifecycle strategies, offering product extension, diversification, and phasing out weaker products can be done. In terms of place, developing multi-channel distribution systems like hospitals, clinics, satellite clinics, and vaccination centers can be done in collaboration with the company. In terms of promotion, tapping into brokers, firms, and intermediaries which sell insurance products, and looking into Universal Healthcare Act and policy making, and engaging in stronger digital marketing campaigns can push for the company to survive. COVID-19 has struck the entire nation. In line with this, the company has to make the necessary adjustments by shifting into online platforms, providing services for its customers. Making online consult in the ValuCare teleconsult platform, creating avenues for customers to apply and seek approval for ValuCare transactions, creating virtual meetings for corporate accounts in explaining the quotations to its members, dependents, the product packages, creating partnerships with laboratory services, performing on-the-go procedures, and making lab services available for the ValuCare members, establishing satellite clinics to limit hospital exposure, preventing the spread of COVID-19 in the nation. The uphill climb to the top will be a very challenging one for ValuCare. However, this can be done if there is the Panalo winning strategy. Let's go for the win. It involves using optimized funds utilization, a strategically priced health card, offering enough riders for health insurance for its members at an affordable price, diligent in communicating its slogan, "You can count on us." There has to be 100% customer satisfaction, establishing a health card for the new normal, and strengthening and forging bonds with healthcare partners nationwide. There has to be frontliner coverage, preparing competitive packages for frontliners and their families, particularly healthcare workers, courier drivers, and security guards. Seniors can also be covered by offering packages to them, our retired heroes. Packages may involve outpatient consult and diagnostic workups for the elderly and geriatric population and our school teachers who are retired. Creating standalone clinics equipped with in-house doctors and strengthening the teleconsult platform can be part of the Panalo winning strategy. The company can focus on comparative advertising, which builds on dental coverage, international financial assistance. These can be taken advantage of for a better product. Incentivizing customers can also create a high level of involvement, boosting interest and excitement to lagging products. The use of hashtags can also be used by the company. As a summary, the profile, problem, solutions, USP, positioning, peso market size were presented, as well as the product strategy, price, promotion strategy, place strategy, and the adjustments in the 4 Ps were done. The Panalo winning strategy was also presented. Once again, thank you very much. We are Group 5.